Here we are at the last stop of Milestone 2, and we're going to look at acute versus chronic treatment plans. So if you're here, you're probably in the PCS stage. And so will any of this apply? Will any of what we were talking about apply because it's been weeks or months or even years? Yes, let me show you. So first, how do we even manage an invisible injury, something we can't see on CT, MRI, blood, etc.? Remember the symptom generators. I called them buckets before, but there are 5 big reasons that you have symptoms, 5 buckets that you can carry around. And when we address those symptom generators, when we empty the bucket, we actually improve your symptoms. So what we're going to look at next is this algorithm proposed for neurologists, which is really interesting. This paper was written for neurologists. I adapted that little algorithm so that I could present it in a prettier way at a conference, but this is what it looks like. So there are pillars to concussion recovery. The first pillar is that concussion rehab is going to be symptom limited. We're not going to throw you into an exercise or into a rehab modality to purposely crush you and make you feel like crap for the next 3 days. We want you to flirt with symptoms, but we don't want you to bedridden yourself for the next 2 days because you did too much vestibular rehab or too much exercise. On that note, because it's symptom limited and we want to flirt with symptoms, we want to do some things that are maybe going to provoke symptoms in a controlled manner. So rehab is actually active. And if you do it right, it's often game-like and playful. And so what you'll notice about the rehab, if you look at this algorithm, is that treatment is very bucket specific plus exercise. And we'll talk about how to do all that later. But if you're in the autonomic physiologic bucket, you're going to do subsymptom aerobic exercise. If you're in the cervical spine bucket, you're going to do subsymptom aerobic exercise and cervical spine rehab. If you're in the visual vestibular bucket or the vestibular ocular bucket, you're going to do subsymptom aerobic exercise and visual or vestibular rehab. If you're in the psychological or trauma bucket, you're going to do subsymptom exercise and cognitive behavioral therapy or counseling or whatever for the psych bucket. But really just know that we're not trying to crush you on purpose. It's symptom limited. We want it to be active in getting you back into the real world or sport or game or whatever it is that you do. And we want it to be specific to your symptom generators. We want to address those generators so that they no longer generate. And it can look like this: subsymptom aerobic exercise on a treadmill, on a stationary bike, on a rower. It could be walks around your neighborhood, whatever you can do. It's going to be foam rollers and lacrosse balls for cervical spine bucket to address the soft tissues around your neck, your upper back and shoulders, and even all the way down to your hips. And then say you've got some stuff that shows up in the visual vestibular bucket. Well, we might do balance exercises. We might have you on an exercise ball. We might have you put sticky notes up on the wall. We might have you do all kinds of fun things to get you to flirt with symptoms, to push that threshold so that symptoms don't necessarily stick around and so that you can get back to life. And keep in mind, this is not all inclusive. These are just examples. But let's look at the differences. Is there a difference between acute and chronic rehab? Yes, absolutely. In the acute stage, so this kid that sustained a concussion on the soccer field, we're going to recommend 24 to 48 hours of relative rest. So we're saying, hey, you're not going to hibernate. You're not going to hide in a dark room with no noise and no lights and sunglasses and whatever. You're going to do relative rest. You're going to hang out at the house. You're not going to do too much exercise or cognitive or physical activity. But by 48 to 72 hours, so between days 2 and 3, you're going to begin symptom-limited activity. Do your normal activities of daily living, but don't let your symptoms flare more than 2 points. And then by day 5 to 7, that's when we start other active rehab assessment and management strategies. But if you're chronic, we begin symptom-limited activity right away. We begin the other rehab assessment and management right away. And different from acute, in the chronic stage, we may have to address hormonal dysregulation or gut health or some of these more chronic inflammatory or metabolic issues. Because in the acute stage, if you catch it, you just deal with the neurometabolic cascade right there, and then it's over. In post-concussion, we might have to look a little bit heavier at the metabolic bucket. But regardless, what's true in both scenarios is that we're addressing the 5 buckets. We're looking at the profile, we're looking at what flavor concussion you have, and we're seeing which symptom generators are present to make that profile. So we're addressing the buckets. It is never too late to address the buckets. It is never too late for progress. Acute or chronic, the name of the game is identifying the buckets to help you empty them out. And this is ultimately achieved, and it's beautiful because this is actually what the evidence shows. It is ultimately achieved through appropriate nutrition, movement, and mindset. So over the next 8 weeks, now that we're done with kind of the heady, sciencey, didactic stuff, over the next 8 weeks, we're going to hopefully help you make dramatic progress in how you feel and perform each day. So we're going to move on to milestone 3. If you remember the algorithm I just showed, exercise was a part of every bucket. So exercise is medicine for concussion and PCS, and we're going to talk about it. Milestone 3 is really where we start to get our hands dirty and the rehab gets real. So let's do this. I will see you there.